My case report presentation is about edentulism and obstructive sleep apnea. It was published in the Open Otorhinolaryngology Journal in 2012, and it was published by a group of doctors from Italy from 2 or 3 different universities. Obstructive sleep apnea is a common disease that it is estimated to affect about 2% of middle-aged women and 4% of middle-aged men, and is characterized by repetitive episodes of complete apnea or partial hypopnea, upper airway obstruction, that happen during sleeping. Actually, the obstruction of the upper airways can happen in multiple anatomical sites from the nose down to the larynx. But the most common obstructive site is located in the retropalatal and the retroglossal area. About edentulism, it is definitely can change the anatomy and affect the function of the upper airway. That's why there are many dentists recommend the obstructive sleep apnea patient to sleep with the denture in. But typically, edentulism is not recognized as a risk factor for sleep-related breathing disorders yet. Our subject of this report is a 55 years old male with a body mass index of 33, so he's obviously obese. His medical history is showing multiple problems, including hypertension, type 2 diabetes, heart disease, obstructive lung disease, and also he was reported to be suffering from OSA. And in 2010, he received a complete sleep study, the polysomnography. Polysomnography is a sleep study that records certain body functions during sleeping. And these functions includes airflow in and out of the lungs, blood oxygen level, brain waves, breathing efforts and rate, muscle activities, eye movement, and heart rate. So he got that done, and after he got that done, he was diagnosed of moderate OSA with an AHI index of 20 per hour, and then they request an oral evaluation after that. So for his oral evaluation, he went to School of Dentistry, University of Foggia, Italy, and the findings were microuvula, flat palate, tonsil score of 1. The tonsil scores is from 0 to 4, with 0 indicating that the tonsils are absent, and grade 4 is indicating that they are grossly enlarged. So he was score 1. And also he has a large tongue with a Malampati score of 3. The Malampati score is based on the visualization of the pharynx with maximal mouth opening and tongue protrusion in the sitting position. So his Malampati score was 3, and that means that it is you only can see the soft palate and the base of the uvula and not much of the pharynx. So it is really tight in there. And also he is edentulous, and he's wearing a new set of upper and lower dentures, and it was just made about 2 months before the study. They did also cephalometric images with tracing, and they did the images with and without the dentures. And then they request another polysomnography without the dentures, because the first one was done while he was wearing the dentures, so they can compare the AHI and the SaO2 in both studies. So the results after they did the cephalometric studies with and without dentures, and they did the polysomnography with and without dentures, the results were quite interesting. So they measured the posterior airway space, which is back here, high, mid, and low. So the high posterior airway space, it went from 6 millimeter with dentures to 11 millimeter without denture. And the mid posterior airway space went from 5 millimeter with dentures to 10 millimeter without dentures. The low, it went from 11 to 15. So that's quite a difference. That's almost as double. And for the HI, it was a dramatically change. It went from 20 down to 5. The oxygen saturation went from 94 to 96. The MPH is that's the distance between the hyoid bone and the mandibular plane. I don't know why did they measure that anyway. But obviously there's a big change between the results with the dentures and without dentures from the cephalometric studies and from the polysomnography study. So from the results we've seen, and since the patient reported a great relief of symptoms after he stopped wearing dentures at night while he's sleeping, so it is possible to say that the edentulism does not always favor the upper airway obstruction during sleep. And in fact, from the polysomnography and all the comparison we did with and without, the HI was significantly worse in the night slept with dentures than in that without them. And that takes me to the end of the presentation, and thank you for your listening.